How much masturbation is too much? The surprising risks you didn't know about. Did you know that masturbation, while being a natural and common activity, can actually pose some risk to your health if done excessively or incorrectly? Yes, you heard that right. As much as it's often praised as a healthy outlet for stress and a way to improve sleep, there's a fine line between healthy masturbation and habits that could lead to serious consequences. In this video, I'm going to answer the burning question, how much is too much? We'll look at the potential harm that can come from certain masturbation practices that you might not even realize are dangerous. But before we dive deep into the science, let me ask you, have you ever wondered if your masturbation habits could be causing harm? Are you aware of the potential dangers that may be lurking behind those seemingly harmless routines? Stay tuned as we uncover some surprising facts, and by the end, you'll have a clear understanding of how to maintain a healthy balance. Make sure to hit like, share, subscribe, and let me know your thoughts in the comments below. Let's get started. Section 1. Traumatic Masturbation Syndrome. Have you ever heard of traumatic masturbation syndrome? This term might sound like something out of a medical textbook, but it refers to an alarming issue that can arise from certain masturbation positions. In fact, this was first described by Dr. Lawrence Sank in 1998. It specifically points to the harmful effects of masturbating in a prone position, lying on your stomach, or pressing your genitals against a hard surface, like a pillow or a bed. Studies are limited, but anecdotal evidence from both doctors and patients suggests that this practice could lead to various sexual health problems. Some of the symptoms reported by people affected by traumatic masturbation syndrome include low sexual desire, difficulty achieving orgasm, and problems with erectile function. To give you a clear idea, a study looking at nearly 2,600 men who experienced premature ejaculation found a correlation between certain masturbation habits, like rubbing through clothes or engaging in prone masturbation, and erectile dysfunction. This raises an important question. Could a simple change in your position while masturbating make a big difference in your sexual health? We'll talk more about this later, but first make sure to like and subscribe if you're finding this helpful so far. Section 2. Death Grip and Habituation, 00230. Now let's talk about death grip, a term many men have likely encountered but may not fully understand. The death grip refers to the excessive pressure applied to the penis during masturbation. This behavior can lead to what doctors call habituation, meaning your body becomes so accustomed to a certain level of intensity that it may no longer respond to lower levels of stimulation, either from your own hand or from a partner. This can become a vicious cycle. For instance, when a man starts using a very firm grip during masturbation, his body begins to require more force to reach orgasm. Over time, this leads to reduced sensation, making it harder to climax during sex. It's important to note that this issue isn't just about the grip itself. It can also involve things like speed, position, or even the use of certain objects or fantasies during masturbation. A study of 500 men who had delayed ejaculation revealed that 37% of them admitted to having unique or idiosyncratic masturbation practices, meaning practices that could not be replicated during partnered sex. These practices might involve the use of specific items or positions that make it difficult to achieve the same level of pleasure with a partner. This raises an interesting point. Could the way we masturbate be preventing us from fully enjoying partnered sex? And what can we do about it? Section 3. The role of hormones, medications, and lifestyle, 00400. Before you start blaming yourself for any issues, it's important to recognize that there are many other factors that could affect your sexual health. Hormonal imbalances, particularly a drop in testosterone levels, can contribute to changes in sensation. Medications like antidepressants, which can impact sexual function, also play a role. Lifestyle choices, too, are significant. For instance, sedentary habits, especially during long periods of sitting, like during the pandemic, can reduce blood flow to the genital area, which might lower sensation. Similarly, excessive cycling can put pressure on the perineum, potentially leading to numbness or reduced sensitivity. These issues highlight the complexity of sexual health. It's not always about what's happening between the sheets. It could also be related to your overall health and lifestyle. If you notice any changes in sensation, it's important to consider these factors before jumping to conclusions. Section 4. How to fix it. Taking a break and changing habits. So what can you do if you're experiencing issues related to excessive or harmful masturbation habits? The first step is often to take a break. Allow your body to reset by abstaining from masturbation for a couple of weeks. This gives you time to regain the natural sensations that you might have lost due to habitual behaviors. When you return to masturbation, try varying your techniques. Incorporating lubrication can help reduce friction and create a more comfortable, pleasurable experience. It's also helpful to step away from external stimuli, like pornography, and try focusing on internal fantasies instead. This shift can help reintroduce a sense of novelty and excitement. One important point here is that you don't have to do this alone. A sex therapist can offer guidance on techniques like sensate focus, where the goal is to focus on the sensation of touch and pleasure without the pressure to perform or achieve climax. This method can help you reframe your relationship with sex and pleasure in a healthy way. Section 5. Penile fractures and the dangers of aggressive masturbation. 000630. If you're practicing aggressive techniques, such as bending or forcing the penis during masturbation, you could be at risk for more serious injuries. A penile fracture occurs when there's a tear in the lining of the erectile tissue during an erection. This is often accompanied by a loud popping sound, swelling and pain, and it requires immediate medical attention. Even less extreme forms of aggressive masturbation can lead to microfractures or injuries that cause scarring, resulting in conditions like penile curvature. These injuries often go unnoticed, but can have long-term effects on both sexual function and appearance. So the next time you're tempted to apply excessive force during masturbation, think twice. Protecting your body is just as important as enjoying pleasure. Conclusion. By now you might be wondering, how much is too much? The truth is, there's no one-size-fits-all answer. Masturbation is healthy as long as it doesn't interfere with your daily life, relationships, or responsibilities. If you find that it's becoming an obsession, or if you're struggling to enjoy partnered sex, it may be time to reassess your habits. Remember, masturbation should be a source of pleasure, not pain or frustration. If you're facing issues, it's crucial to listen to your body, take breaks, and consult a professional if needed. Lastly, if you want to dive deeper into the world of sexual health, check out my videos on topics like pornography addiction and testosterone levels. If you found this video helpful, don't forget to like, share, subscribe, and leave your thoughts in the comments below. I'd love to hear about your experiences or any questions you might have. Final thoughts. In conclusion, moderation is key. Masturbation can be a healthy and enjoyable part of your life, but when done excessively or incorrectly, it can lead to unwanted consequences. By staying mindful of your habits, exploring healthier techniques, and seeking professional help when needed, you can ensure that masturbation remains a positive and fulfilling experience.